During the World Allergy Week, the medical fraternity pledges to raise awareness about allergies and their related disorders. This year, the theme and educational focus will be on the agony of hives. Have you ever wondered why do you develop an itchy, blotchy rash that looks like a nettle sting? Hello and welcome to this very informative and invigorating panel discussion with me, Samriti Grover, on understanding chronic urticaria. Through this episode, we aim to address concerns associated with the disease and how it will help to improve the quality of life of patients suffering from chronic urticaria. Today, I am joined by an illustrious panel of doctors with me in the studio. I have with me on my right Dr. Kiran Godse, Professor of Dermatology at D.Y. Patil Hospital in Navi Mumbai, Dr. Muralidhar Rajagopalan, who is a senior dermatologist at the Apollo Hospitals in Chennai, and Dr. Sandeepan Dhar, Head of Department of Pediatric Dermatology at the Institute of Child Health, Kolkata. And on my left, I have Dr. Abir Saraswat, who is a senior dermatologist in Lucknow, and Dr. Sanjeev Kandhari, who is also a senior dermatologist in the National Capital. So thank you everyone for joining me, and let me begin with you, Dr. Abir. You know, as I was mentioning in my opening address, that some of us, often develop a rash and we don't know what is the cause or why is it, developed. So I want you to take us through what exactly are hives or urticaria as we are talking about, and what are its types.
See, urticaria is a very, very common rash that almost everybody has once or the other in their lives. And it presents as a reddish patch of skin, which is fairly well demarcated. It is usually raised and is very itchy, or there might be a burning sensation as well, along with the itchiness. And the hallmark is that it doesn't last for very long. It lasts for a few minutes to a few hours and then it goes away. But it has a tendency to come back. So that's what hives or urticaria is.
So, Dr. Sanjeev, can you talk about the types of urticaria that exist currently?
Well, essentially, urticaria could be of two types, an acute variety and a chronic variety. A basic two groups, acute is less than 6 weeks and chronic is more than 6 weeks. Then, of course, the chronic can be spontaneous urticaria or it can be induced by something like a physical factor like a stroke of friction, sun, or it could be cold or heat or things like that. So, essentially it falls into two groups, acute and chronic.
So, since we want to shed more light on the chronic type of urticaria, Dr. Godse, can you describe for me what exactly is chronic urticaria and what are the symptoms?
Yeah, the chronic urticaria can last from 6 weeks to months and years together. So, the essential picture is same. There are red itchy hives all over body, they come and go. They actually debilitate a person because they come anytime. When I am speaking, they can get it, and they are really bothered that itchiness is troublesome to them, and it can last to many years. So, that is most troublesome part, and they actually damage the quality of life of the person.
So, if I have to ask you, Dr. Muralidhar, when a person sees a rash on their body, there is some sort of scare that what has happened if it doesn't go in a short period of time. So, do you think patients need to change their mindset and not hyper about it as soon as they see something like that?
Ms. Grover, frankly, absolutely yes. The moment a patient sees something coming up abruptly on the skin, there is considerable degree of panic. The panic is more because he sees something coming up which he doesn't understand, and also because of many myths that are circulating. So, it's important that a patient sees somebody who knows about urticaria, especially chronic or even acute urticaria, to explain what is happening to him. They are also worried when it tends to last in spite of the best treatment, and they are worried because they want you to put an endpoint to when you are going to stop treatment. They don't want to accept this as something that may go on for a long time. But there are several fears in the minds of patients as regards urticaria.
So, Dr. Dhar, if I have to ask you, what is the incidence or prevalence of chronic urticaria today? And is there a particular age group that we see this disease occurring?
I think by and large the incidence all over the world, including in our country also, it is around 2% chronic urticaria. It is said that in a person's lifetime 2% of the patients they get urticaria. This is a significant percentage, because just think of that out of 100, 2 people get urticaria in their lifetime, which is going to last beyond 6 weeks time. Age group, as you have very rightly asked, by and large the age group is from young adult to adult age, maybe from 15, 16 to 40, 45 years. But the concern is, since I am a pediatric dermatologist, the concern is the earlier our concept was that in pediatric age group, urticaria means acute urticaria. But a significant percentage of children, 30% of all urticaria cases in children, we have been seeing chronic urticaria cases. This is something of great concern.
Also, Dr. Godse talked about the quality of life, how that is affected, and I want to get that point in at this discussion now. So, if you can talk to me about, since, every day we have to go to work, we have our normal day-to-day operations that take place. There are special occasions that we want to attend, and, those are important to us. So, how is the quality of life affected of a patient who is undergoing a chronic urticaria treatment?
Fairly badly, because the sheer unpredictability of chronic urticaria is what takes its toll on you. And you know that whenever you are at your most vulnerable, whenever you are most before that crucial interview, or when you're going in for your exam, those are the high stress situations when urticaria is likely to hit you the most. And it unnerves people. See, just the itching itself, and the severer forms of urticaria, if it affects your mucosa, if it affects your mouth or tongue, it can lead rarely to life-threatening compromise of the airway, and you might have trouble breathing. You might have a bowel movement which might be uncontrollable. So these are the other forms when urticaria becomes severe. It can really make you suffer, and there are studies that have shown that the amount of impairment of quality of life is akin to certain very severe diseases, like a heart disease or asthma, as bad. So people tend to underestimate, considering that this is just a skin disease, but it can have fairly bad consequences on the skin, and especially you add all this to the fact that it could go on for years together. There is no end point. We don't know. Most of the patients do get okay by 2 to 5 years if they have chronic urticaria, but quite a few of them can have it for 10 years, 20 years.
Many of my patients have had that kind of a thing, when they come to my clinic, throughout the day they are having redness all over the body. Just imagine so much of redness, so much of itching, it almost drives you crazy. You almost have to run to the hospital to take an injection, probably at some time. So, they're almost scared to get their particular attack. So I think the quality of life really can suffer.
30% of children have chronic urticaria. Now, if the urticaria is bad enough and the child doesn't attend school, the school is, most situations, it's not going to be very nice to the child and say that, okay, it doesn't matter, you have urticaria, we let you off, but they lose the attendance. The quality of life makes a difference.
Can you, Dr. Godse, take us through, the treatment process, and what is the first thing that you would perhaps advise the patient and see how is that affecting?
Yeah, typically the treatment has been a non-steroidal antihistaminics that should be taken, because treatment is going to be long, few months to several years. So we insist that they should start with a non-steroidal antihistaminics. They can start with 1 tablet. If there is no response, you can make it 2 or 4 times the dose. That is being endorsed by most of the international and Indian guidelines also, that you can start with the non-steroidal antihistamines, and topically they can use soothing lotions to control the hives. And the treatment is actually, we have to judge the treatment, how the symptoms are, how the treatment is responding, but the best first line treatment by all the guidelines is a non-steroidal antihistamines.
But Dr. Muralidhar, why is that then, we obviously give preference to the second generation antihistamines than perhaps the previous generation one? Can we do a comparative analysis on the two?
When you talk about antihistamines, this first generation antihistamines, when you're using on a long-term basis for urticaria, have this problem of what we call as cumulative sedativity. Over a period of time, the sedation and the drowsiness keeps getting added up. Now, that can affect fine abilities of using the hands or learning. So mental alertness can all be affected. So if we know, and when we counsel our patients on day one that you might be in for a long haul of treatment, he doesn't want to be on a drug which is going to knock him out for an unknown period of time. So therefore, he would like to be on a drug which may keep him more alert and probably even drive, probably fly an aircraft.
Especially, it's important in elderly people or younger children. Sometimes in elderly people there is urine retention because of the first generation antihistamines. That I think is an important issue when an elderly patient is involved, and sometimes even dryness of the throat or the mouth can start coming. So I think these are issues which need to be kept in mind, and therefore we tend to prefer the second generation. We don't give these kind of issues in addition to what Dr. Murli has said.
On that note, time for a quick breather, but when we come back, we tell you more about understanding chronic urticaria.